Good morning, Symbiosis. So it is a real honor to be here, part of Sim Health 2024. And I would like to add something that he has not mentioned about me. I'm a teacher of medicine. Okay, my last full-time job, I was vice principal and head of preventive medicine in a medical college where I had the honor of working alongside your own dean, Dr. Sagar, and it's indeed a great joy for me to have been invited here to speak about sustainable healthcare. Now, being a teacher myself and also being the first speaker of the first track, I would like to take the honor of educating you a little bit about sustainability in healthcare, because this is something that I get asked quite often. What exactly is sustainability in healthcare? What is sustainable healthcare? What are the fundamentals of that? And we will begin the session by touching upon the fundamentals of sustainable healthcare, and then I will go on to highlight a few things about the global perspectives in sustainable healthcare, and I'll wind up my session by telling you what we are doing in this domain, all right, and how Symbiosis and the youngsters who are here can be part of that. This is the whole crux of what I'm going to do here over the next 30 minutes or so. What does sustainability mean? Sustainability is actually the need for continuity. It simply means that what we have for us should be there for our children also. Not just our children, but our children's children and the future generations. All right, and this is what sustainability is. And the unfortunate thing is that in just over a generation, we have sabotaged this in such a great manner. Over the last 50 years, we have done a lot of damage to continuity. All right, and why should there be continuity? The need for continuity is that the resources on this planet are limited, greatly limited. Earlier, when the population was also limited, we never bothered about that. We never really felt the bite of the resources being limited. But as the population increased and there are more takers for the resources, we have come to a place where we are started to feel the pinch about the resources being limited. And by definition, sustainability is about meeting the needs of the present without compromising the needs of the future. So that is in a simple sentence what sustainability is all about. Now, I'm sure you would all like to hear stories. All right, now and what I'm going to do is that I'm going to tell you the brief history of unsustainability and what led to globally people started speaking about sustainability. Once upon a time, man invented fossil fuels. That is how the story begins. And even though fossil fuel use, especially in the form of coal, has been prevalent for many millennia, is actually somewhere in the middle of the 18th century and the entirety of the 19th century that man came upon huge resources of fossil fuels. And this source of energy, when it was come upon, we started exploring how we can utilize this source of energy, and that's how the Industrial Revolution came about started in the middle of the 19th century, and also it went into the 20th century. That is what happened. Now, what does Industrial Revolution do? It is, to put it in very simple terms, Industrial Revolution explored how the newfound sources of energy can be put to simplify our lives. Okay, through mechanizations, you heard about all the engines that were developed, the diesel engines, the coal engines, the steam engines that were developed in the 18th and 19th century. And also, we started exploring ways in which we can create these machines. All right. So the mining activities started happening in a large scale, and we started. One of the other areas that we explored is putting into use petrochemicals for different uses. All right. And this is how it all started. Now, when industrialization through the Industrial Revolution started to happen, urbanization. All right, because people wanted to move to those places where these these industrial activities were happening for want of a better lifestyle. And urbanization started happening, and you know the fallouts of urbanization, overcrowding and the resource crunch that urbanization brings, those things. Now, when urbanization is happening, industrialization is happening, there is competition between people who can achieve the biggest slice of all these things. And that is how the market economy started booming and things started becoming competitive. And when this started, and whenever you want to do something better than the others, what do you rely upon? You rely upon technology. Alright. And technological advancements over the last 100 years has been unbelievable. Alright, now we are at a point where, I myself represent a company which is into AI and robotics. We are at a point where you don't need humans anymore. Okay, that is where we are. But as it evolved, some very important things that happened in the field of technology is in healthcare and agriculture. Alright, people started having long lives because of the inventions in healthcare like vaccines, antibiotics, and other public health measures, and also in agriculture, better food. For the first time, people started living longer, and because of this, the population exploded like anything. Alright, and again, when population explodes, the resources are scarce, and this led to social inequalities, or in healthcare terms, you call it social inequities. Alright, and this inequity started the world to be polarized in terms of so many different things. One thing is the haves and the have-nots, the developed, the underdeveloped, and the developing world. And also, at the end of the Second World War, there came to be something called the Cold War between two politically polarized worlds. Everything taken into account is what led to unsustainability and environmental degradation. Now let's see what is the cost of unsustainable development. Now, we know about the drastic climate change that is happening. You don't need. I'm not a climate change expert. I'm not a global warming expert. But we all know what harm it is doing to the environment, to the climate, or the rising sea levels, or the carbon emissions, and all this. But one of the things that we are seldom speaking about is the extreme loss of biodiversity. Alright, biodiversity is, so much, the flora and fauna of the world is so much depleted. Some estimates say that 70% of the flora that existed 100 years ago and the fauna that existed 100 years ago is no more than the species are extinct. Alright, so this is what we have done to the planet over the last 100 years. And this leads to severe resource depletion and unbridled waste generation. See, the soil from which everything is springing up, including our food, and we ourselves is springing up, is so much depleted. Okay, the food that we cultivate these days is nourishment poor, nutrient poor. So that is what is happening. Unbridled waste generation, economic instability. As I said earlier, when the population is more, the resources are less, it leads to economic instability and conflicts and war. Okay, look anywhere in the world. At any point of time, there is some conflict or war happening. And what is it happening for? It is happening for the resources actually. Alright, especially it has been happening for the fossil fuel resources. The next war, they say, is going to happen for water and food. This is not far away. This is the near future. This is the immediate future. And this also led to public health disasters like the pandemic that we went through. Like we all went through. We are all victims of that. In the last 100 years, this has not happened. Something like this has not happened, and every sector, everybody is hugely set back by this pandemic, and which is also a result of unsustainable development. Now, in this context, it's very important to speak about the three pillars of impact, which is the social, environmental, and economic. Whenever we say about sustainability, we emphasize on these three pillars. Whatever we do in the world should be socially sustainable, which means, the people. It should be environmentally sustainable, which is the planet, and also economically sustainable. The last P of profit is seldom spoken upon. Because especially if you take the context of healthcare, especially in India, there is the public sector and the and the private sector, and the private sector of healthcare has always been at the receiving end. It's somehow, whether it be the government imposing pricing limitations on the private sector, or the private sector themselves raising to the bottom by reducing the price and all those things. See, for something to be sustainable, it has to be profitable, at least marginally profitable. So you cannot sustain with something that is not cost effective for the providers. So all these things play together, the three P's of sustainability. Now, my intention is not at all to speak about the sustainable development goals, but I have to touch upon this because this is one thing that is driving the whole thing in the world. If you remember, before this, we had the Millennium Development Goals, right? The Millennium Development Goals, it ended by the year 2015, started with the Millennium Declaration, and I happened to be a consultant with UNICEF during the last 5 years of the Millennium Development Goals, and I was shocked to see the level of change that happened in the health sector during those last periods, because people were so driven by goals. Okay, the governments, they changed their objectives, their policies, everything was changed. Many states in India achieved great healthcare indices just because of the Millennium Development Goals, and now we are entering the last 5 years of the Sustainable Development Goals. Goal 3 is about healthcare, and in that there are multiple targets, 13 targets, indicators. The whole thing, I'm not going to mention the targets or indicators, but the whole thing is about universalization, okay, or in other words, social equity in healthcare. So that is what it's all about. And one more thing, goal 17. Okay, there are 16 goals, and the goal 17 is about collaborations and partnership, because they have identified that collaborations and partnership is the way for achieving sustainability. It cannot be done alone. All right, and in that there are so many targets and indicators, around 19, which can be broadly divided into resource mobilization from interstate, state, and other funding agencies, corporates, so on and so forth. Goal 6 and the targets 6 to 8 says about optimal use of advanced technology. Then we have 9 to 15, which says about systems creations. All right, and the final one is about partnership, and the final few are about partnerships and collaboration. Health impact of environment. See, this is not something that I need to tell you who are all from the health profession. The greatest victim of unsustainable development is health. Okay, whether it be the health of the planet, the health of our fellow organisms in terms of flora and fauna, our fellow beings. We call each other our fellow beings, but the animals, the plants are also our fellow beings. Okay, in terms of those are fellow beings, and also definitely the human beings. And from this has the concept of One Health sprang into great popularity. We say that the only way we can safeguard the planet is through considering each and everything as part of one system. We human beings and the environment is wrong. We are the environment. We are the planet. We sprang up from the planet, from the soil of this planet. We are part and parcel of the environment. What we do to the environment, we do it to ourselves. This is the philosophy behind the concept of One Health. So definitely the health impact of environment is great. Now, we also need to speak about the environmental. So this is the whole thing, right? We are gathered here for 2 days to speak about the environmental impact of healthcare. Now, some may think that this is not big. Okay, what big impact can healthcare have on environment? It is just an essential activity which need to be, which happens in a very low level, but that is not so. Healthcare happens to be the field in which the most toxic kinds of waste are generated. All right, and it is called polyhazardous. Polyhazardous in the sense it generates toxic chemicals, biological agents, radiological material, and non-biodegradable materials. What does that mean? You know about the various toxic chemicals and all, biological infections. We went through the pandemic, right? Infections are generated, radiological material, and what about non-biodegradable? See, we have come to a stage in which everything in healthcare is one-time use or reusable, right? We do not, see, earlier we used to have glass syringes, now we have, of course there is great scientific rationale for using disposable syringes, but everything is one-time use, non-reusable. All right, and that has led to a lot of generation of non-biodegradable waste materials. Wastewater generated from healthcare contains all kinds of toxic chemicals, from bleaching powder to mercurial compounds. All right, so that is a huge problem. Greenhouse gas emissions and resource depletion. It is not directly from the healthcare activities of the hospitals and other healthcare establishment, but because of the supply chain. Okay, whatever is needed for healthcare is created through a lot of industrial process, and this leads to a lot of greenhouse gas emissions and also resource depletion. All right. Now, you might be familiar about this term called medical grade. I've heard about medical grade. What does medical grade mean? Something that is of the highest quality, right? And how do you create something of the highest quality, right? You do it through refining and filtering and purification, right? So in order to create something that is of medical grade quality, you need to put in a lot of resources. So that is about resource depletion. This is the per capita, the per bed hospital waste generation globally, compared between the countries. You see on top is USA and Canada. Okay, their per bed hospital waste generation is close to 10, somewhere in the region of 8 to 9. All right. And in India, if you look at the bottommost graph, the bar, you see India, which is around 0.5 kg. All right. What this means is not just if you will be looking at the greenhouse gas emissions also. It is the advanced countries who are generating maximum amount of hospital waste. Okay, we are not there. Maybe because of our quality of care is less and so many things are not at par with the advanced countries, but it is the developed countries that are generating maximum hospital waste. The resources consumed by the healthcare is concerned. There are energy resources, water resources, biological resources, mineral resources. What are the mineral resources? It's very important. All the pharmaceutical agents that we use in healthcare comes from the mineral resources. All right, mining and purification of these materials, and so on and so forth. And also comes from the fossil fuels, from the petrochemical industry. Many of the medicines come from petrochemicals. Even though there is a lot of other ways in which environment is degraded, the favorite way of describing in the world currently is about the carbon footprint and greenhouse gas emissions. 4.4% of the global emissions is contributed by healthcare. Can you believe that? 4.4%. Overall, this is the figure. 2 gigatons of carbon dioxide generated every year, and it is bigger than other industries like aviation and shipping. Last week, we were all looking at videos of the queen of Indian skies, the Boeing 747 being retired, and it is giving a wing shake and everything flying off. 4-engine jetliner, unsustainable. We retired that. So healthcare is causing more greenhouse gas emissions than the aviation industry. That is not believable. Equivalent to 514 coal fields and here, very important, US and China and EU contribute to 56%, and India is in 7th position. Again, it is the industrialized countries that lead to maximum contribution for this. In terms of this, you also need to be familiar with the scope 1, 2 and 3 emissions. From the healthcare context, scope 1 means direct, 2 and 3 are indirect. Alright, direct means whatever is the organization or the institutions who are actually running the services are generated. For example, the emissions by the vehicles used by the hospital. For example, Symbiosis Health University is having so many vehicles, and you could be generating a lot of toxic gases, emissions from those vehicles. Those come under scope 1. But under scope 2 comes because of the energies utilized by the healthcare institutions, and the energies are generated elsewhere. Scope 3 is about the supply chain. Alright, the value chain, because a lot of materials need to be created for use in the healthcare industry, and further it goes down for the disposal of these waste materials. Okay, but once it is used, it has to be disposed. And scope 3 is that. And this is just a graphical representation of what scope 1, 2, and 3 is from a healthcare point of view. I'm not going to go into the details of that for a short of time. We come to the definition of sustainable healthcare. It is organized medical care that ensures the health needs of the current populations are met without compromising the health and well-being of future generations. I don't have to explain this to you again and again. This is what sustainable development or sustainable healthcare is all about. These are the 4 principles. These are derived from these goal 17 of the UN Sustainable Development Goals. Alright, and these are the 4 principles of sustainable healthcare. One is inclusivity, second one is resource effectiveness, optimal technology, and shared responsibility. The first one is about universal healthcare. Okay, and what the first one is what we need to achieve. Alright, second and third, how are we going to achieve that? Through resource effectiveness and through optimal use of technology. And the fourth one is who is going to do that. That means it is a shared responsibility through partnerships and collaboration. Now, what I'm going to show you next will surprise you. Alright, look into this. This is from the 1978 Alma Ata Declaration, which declared that primary healthcare is a basic human right. Alright, it happened in a place called Alma-Ata in Russia, and we came up with these 5 principles of primary healthcare 50 years back. Alright, and believe me, these are exactly same as this. In fact, there is one more. Okay, equitable distribution means social equity. Alright, that is universalization. Community participation and intersectoral coordination means how we should do that. Alright, through shared responsibility. Appropriate technology was mentioned 50 years ago. But at that time we were speaking about ORS, vaccinations, and all those kind of things, like public health. But that was mentioned 50 years back. And affordable cost, at the cost that the community and country can afford. I'm sure there are a lot of preventive medicine and public health people here. We keep teaching this to our students at a cost at which the country and population can afford. So that this is also what took us 50 years to come again to point zero. So one thing is that a lot of environment, this 50 years in which we neglected what primary health care was saying, we led to a lot of environmental degradation, resource depletion, loss of flora and fauna, and a huge pandemic, and how many deaths and suffering we have to go through. How many of our medical faculty have given their lives because we ignored something that was said very clearly 50 years ago. Now, there are a few enablers and barriers which will help in achieving this. I don't want to go into the detail of all these things owing to the lack of time. I'll just go say that there are individual level barriers because people need to accept this. Okay, individual people need to accept this as a new way of living, and the health sector workers should take it as their individual responsibility. So these could be the barriers. Organizations need to implement, they need to invest and implement sustainable measures in healthcare institutions. And at the system level, I cannot help but mentioning, do we have a universal healthcare portal where there is interoperability between different stakeholders of healthcare? Even the same stakeholder, can the data of a hospital elsewhere be accessed from symbiosis? We do not have that. There are vested interests that do not allow those things to happen. Okay, so there are system level barriers. Now, these are what I have mentioned here is from the WHO strategy document on sustainable health systems. They have identified, for some reason the 10th point is not visible, but don't worry about that, I'll be showing it again. They have identified 10 action points because this is all about taking actions. I may, or even the other speakers may go on lecturing about what all these things are and how it can be solved. Unless action happens at the ground level, we cannot make a difference. And these are the 10 action points. Which I have done is that I have superimposed, you saw the 4 principles of these 4 principles, the 10 action points I have superimposed on these 4 principles, and I am showing it to you. First comes the shared responsibility. Out of those 10, these 2 come under shared responsibility. Adopting a national environment sustainability policy for health system. So the shared responsibility starts at the country level or the state level, where there has to be policy formulation about sustainability in healthcare. And the second one that is there under shared responsibility is prioritizing disease prevention, health promotion, and public health services. Believe me, this is the most impactful measures as far as sustainability in healthcare is concerned. And this happens at the individual level. Okay, disease prevention. That is, we all know that prevention is better than cure. We all know that that prevention is the best and the most cost-effective way. I'll give you a couple of examples. For example, we know about eating healthy, right? To stay healthy, we know that vegetable or plant origin foods are better than animal origin food. All right. From a health point of view, we all agree, especially in the medical profession. But what about the cost of plant origin food? Are they more expensive than animal origin food? Plant origin foods are cheaper than animal origin food. And what about the environmental sustainability of plant origin food? Plant origin, see, weight by weight, to produce animal origin food takes almost 10 times the resources, including water and other fertilizers and all those things. 10 times more the resources to create equivalent weight of animal origin food. So whichever way you look at it. Take smoking, for example. It's an unhealthy habit. Not smoking is good. It itself produces emissions, right? It produces emissions, and cost of smoking. Look at the cost of smoking. Huge. It's the biggest detriment of human population. And coming to public health, this is also very important. Public health, see, we have always considered public health as a non-existent thing, but it is actually the one thing that has been safeguarding the health of population for the last 150 years. For example, take the treatment of TB. All right, tuberculosis in India, even today, I think around 2 deaths happens every 3 minutes, or in that range. All right, it's the biggest killer infectious disease of adult population even in India, even today. All right, but in Britain, if you know that the first anti-TB, anti-tuberculosis drugs were developed in the 50s, in the late 40s and the early 50s, streptomycin and all those things. Okay? But even before that, in the first half of the 20th century itself, in Britain, TB was brought under control without any drugs through public health measures alone. All right, how did they do that? By making the living conditions of the people better. Overcrowding was reduced, better nutrition, and they had the sanatorium approach where the TB patients. Then itself they were able to reduce the burden of tuberculosis, all right, through public health measures. I can cite any number of examples of public health measures having played a greatest role. You take the vaccines, ORS, or anything you want. Now, that's about shared responsibility. All right, one of the principles. Then we come to resource effectiveness. Out of the 10, these 3 come under resource effectiveness, minimizing and adequately managing waste and hazardous chemicals. So this is about utilizing our resources properly. We need to have a good policy about how the resources can be minimized. For example, one simple thing. Somebody is getting diagnosed through a series of chemical tests in a primary care center or a secondary care center, and they have a diagnosis and they refer that patient to a higher center, to a tertiary center. What they do, they repeat all the tests. Okay, so this does not minimize the resources, the things that get utilized into healthcare. Second one is promoting an efficient management. So I'm sure you have an MBA in healthcare. Okay, so managing, all right, because resources are scarce, we need to effectively manage the resources. And finally, engaging the health workforce as an agent of sustainability. It is all about human resource management. And these 3 are the effective utilization of resources. The third one is optimal technology. In this, there are 3: promoting sustainable technologies and their procurement. All right. the current way of the technologies that are being utilized in healthcare are not at all sustainable. They, for the production of these machines and from rubber gloves to robotics, okay, from masks to MRI machines, all these things are resource intensive. So we need to have sustainable technology for healthcare and also for the procurement process. And also reducing health system emissions of greenhouse gas. Again, you need better technology for reducing emissions. And finally, promoting innovative models of care. I mentioned one thing, we do not have a common healthcare system in India where but the government of India is coming up with something called Ayushman Bharat Digital Mission and the ABHA identity, just like UPI become a hugely successful thing in the entire world, UHI is going to become the next successful thing that India is going to bring up, in which every individual is going to have a unique health ID and they will be registered on the ABHA portal and they can access healthcare through that in any healthcare facility. Government of India is incentivizing this in such a huge manner that you won't believe it. They are giving 10, 20 rupees to healthcare institutions just to register one patient. All right, we are part of rolling that out. And finally, inclusiveness, increasing community resilience and promoting local assets. This is where primary care comes into play. All right, primary care. And also one thing that the pandemic has shown is about the effectiveness of telemedicine. All right, almost 75 to 80% of the common illnesses does not require a patient actually visiting a healthcare facility. It can be done remotely. And also creating incentives for change. At the individual level, we have to create incentives. At the institutional level and also at the system level, we have to create incentives for promoting sustainable practices. And not to speak about healthcare financing when we are saying about sustainability, it would be a crime, because it's all about cost of healthcare, right? And there are these 4 models of cost of healthcare financing globally. The beverage model is it is what you see in the UK. It was implemented in 1948 by William Beveridge. It is the state 100% state sponsored model. The provider of the care is also state. The financing agency is also state. Alright, you predominantly have it in UK, Spain, New Zealand, Cuba, Hong Kong, and some aspects of US. Where there are no private providers, there are no private financiers, everything is there. But the problem with this is that the entire system is so overwhelmed that they have to wait for many months to get elective procedures done. Now the second model is the Bismarck model, which got implemented in Germany by Otto von Bismarck, and this is a model in which the employees, the employers are responsible for providing health insurance to the employees, and this is a mix of the private and public mix. Then you have the national health insurance, in which the state is providing health. We have in India we have the Prime Minister's PMJ, okay, Jan Arogya Yojana, PMJ is there. This is one of the models, national health insurance model, and finally we have the common model that is being utilized in India, which is the out-of-pocket expenditure. Okay, everybody has to pay. So health insurance penetration is so less. Not everybody is beneficiary of the state-sponsored health insurance model and all of those things. So these things need to be taken into account in order to make sure that there is sustainability in healthcare. Now, I would like to wind up my presentation, because see, it's one thing to speak about what need to be done, and it is another thing to speak what we are already doing. This is something that we are already doing. Okay, this is called the Sustainable Healthcare Alliance, and this is a partnership of 8 different stakeholder categories in healthcare. We, this was in the making since 2017, by which a few group of healthcare providers and healthcare technology companies came together to create better technology for healthcare. And this evolved over a period of time to include these 8 categories. The healthcare delivery establishments like hospitals, of course, then the healthcare technology enterprises, healthcare supply chain enterprises, the pharmaceutical companies, the manufacturers of medical devices, and all those suppliers of the medical industry, healthcare financing organizations like the health insurance companies, donor sponsor organizations, because we are speaking about shared responsibilities. We want the cost of healthcare to come down for the beneficiaries. At the same time, it has to be profitable for the providers. Alright, and one of the models that we have identified is to sustain the system through sponsorship, because the sponsors will get their advertisements going, and the provider will be able to reduce the cost, and the beneficiaries, the patients, will get it almost free of cost through this model. And of course, the medical professional associations like IMA, last mile partners are the grassroots level non-profit organizations and NGOs will help in the implementation of these projects, and advocacy and media partners who provide publicity for the whole thing. Now, one thing you might have missed is there is no knowledge partners in this. Okay, Symbiosis being a university, you might think, why are there no knowledge? Because we believe that research does not happen as a standalone process. Research is always R&D. Okay, research should happen as part of developing better technology. The entire purpose of the alliance is to create better technology for sustainable healthcare, and this is what we are doing in this context. We are conducting a global summit on sustainable healthcare in the month of December 14th and 15th, and the Union Health Ministry and the Union, I had an opportunity to interact with our Honorable External Affairs Minister Jayashankar, in which I pitched the idea of this global summit, and they have promised full support from the Union Ministry, including probably the participation of the Prime Minister and Health Minister. We are also trying to get Bill Gates for the summit. We are in communication with the Bill Gates Foundation, and this is happening on December 14th. And I want Symbiosis also to be all of you to be part of it, and please take this as my invitation. And I have been seeing the great minds that are being created. I said we don't want knowledge partners, but we want human resource partners. Okay, I'm sure Symbiosis can play a very important role in supplying quality manpower for not just for the alliance. We have a number of top partners from healthcare industries who are looking to hire quality manpower. So that is what it is all about. I would like to wind up by sharing my contact information with you. This is my phone number, my email address, and especially I'm very active on LinkedIn. That is my LinkedIn and all of the social media tags. So please feel free to connect with me. I'll be glad to help you with anything related to sustainable healthcare. Let's strive together for a sustainable world where healthcare is accessible and available at cost-effective ways for everybody. Thank you so much.